So my name is Daniel Vallaincourt, and I'm a writer who lives in Palm Springs, California. I was diagnosed with AFib in 2013 at the age of 50. Both of my parents had the condition, so it's not a surprise to me that I inherited it from them. My cardiologist, Dr. Bram Beckerman at Desert Cardiology, put me on a variety of medicines for the next 10 months, and none of them really worked well for me. Although I was off caffeine and alcohol and chocolate, which I love, I still had AFib pretty regularly. I remember once I was going to the movies with my husband, and I couldn't even get up the stairs at the theater. I had to stop in the middle and catch my breath, so that wasn't much fun. At the end of that year, in December, Dr. Feldman suggested that I have a catheter ablation. After that procedure, I was put on amiodarone, which is a good medication, but wasn't so good in my case. Although the AFib subsided a bit, it was still there. The medication makes you photosensitive, so I had to stay out of the sun, which is hard when you live in Southern California. Also, I was still off caffeine, alcohol, and chocolate, but I was still getting AFib pretty regularly. 6 years into it, I started developing thyroid problems, and that's when Dr. Feldman suggested that I really should get off it. He said that the standards of care and equipment had changed so much that perhaps a second ablation was warranted. So I said, sure, let's go for it. In my case, the day after that second ablation, Dr. Feldman took me off the amiodarone, which was really a nice surprise to me. 3 months later, he took me off my beta blocker and off my blood thinner. And to this day, I have not had AFib. It's gone, and I'm back on chocolate and alcohol and caffeine, and I never have AFib ever. So I've told Dr. Feldman that he changed my life because it's true. That's exactly what he did.